And also, I'm a mentor. I don't want men to go. One of the reasons why is because I just don't want men to go through what I've been through. Whatever I can do. So, whenever someone is newly diagnosed, stage 4 typically is what I get, and they live in the West Coast, I get a call or I reach out to these men. Men don't talk about it.
For Prostate Cancer Awareness Month this September, I invited Ted Healy on the podcast to talk about his experience. Ted was initially diagnosed in 2018 at stage 4 metastatic and is now NED, no evidence of disease. He has held many different roles throughout his career and is an active member of his community, volunteering with Zero, the End of Prostate Cancer, and advocating for more prostate cancer research and funding. We talked about prostate cancer screening, tumor biopsies, the genetic component to prostate cancer, the impactful advocacy work he does in the field, and how helpful support groups have been for him. Here's my conversation with Ted. Hi, Ted. I am very much looking forward to chatting with you today. I'd love to start by hearing your story and how you were first diagnosed with prostate cancer. Did you have any initial symptoms?
I did. I noticed that I was going to the bathroom more than normal at night. And so I went to my primary, and he said that, well, let's do a PSA. I will start this. My dad had prostate cancer. So he said, let's do a PSA. So we did a PSA, came back as a 4.2. And we can talk more about PSAs, but that's anything above a 4 is considered okay, something may be happening. But he goes, you're an older guy. I was 62-ish, 1-ish at the time. He goes, let's wait 6 months and see what happens. And so we did. And then it came back as a 5.2, and that was a pretty big jump. And he goes, okay, let's go. I'm going to send you to the urologist. So I will say, hashtag, don't be like Ted. If you have particularly if you have a family history, please get tested, because if you get it caught early, you won't be like me. So I went to the urologist, and he told me that because my father had prostate cancer, I was 70% more likely to have it, just starting out. So we did a biopsy, and we did what's called an ultrasound 12 needle biopsy. And again, I'm going to get on my soapbox because this is a cautionary tale. Looking back, if you're a man getting diagnosed with it, get an MRI guided biopsy. A ultrasound guided biopsy is basically an educated guess by the urologist as to where the cancer is, and they're just putting needles in there. It's like core samples. Okay, so it came back that I have what's called a 4+3 Gleason. It was a 7 Gleason score. And again, I don't want to get too much into a rabbit hole because this is a big rabbit hole, but there's two kinds of 7s. There's a good 7, and then there's a not so good 7, and it's based on the score. So if it was a 3-4, and that's the pattern that shows with the pattern of the cancer, a 3 is, the pattern's not too bad. The 4 is like, something's, it's not good. So I had a 4+3, 7. He goes, okay, you need to do something. So I'm like, oh, great. Let me think. There's all these options out there. Do I go with radiation? Do I go with surgery? Do I go, what choices? And they all basically have not great side effects. They're all not great. And I got a second opinion. I actually got a second opinion on my biopsy. And so it came back, yes, you should. I met with a radiation oncologist, great guy. So finally I decided to go with surgery because they guessed that the cancer was still within the prostate capsule. Okay.
Mm-hmm.
So I have the surgery, and my PSA did not go down. It remained what's called persistent. And when they did the pathology on my prostate, they found what's called a tertiary 5. There was a small area that had a very bad, aggressive cancer. And that's where I go with MRI guided biopsy, because if there was an MRI guided biopsy, chances are they would have caught that, and I would not have gone with surgery, because that pushed me to a Gleason 8 or 9, depending on who you talk to. And again, Monday morning quarterbacking, I should have gone with radiation. So,
mm-hmm. So what are some of those other treatment options? So you mentioned surgery, you mentioned radiation.
Yes. There's different types of radiations. There's proton beam, and I did not stay at Holiday Inn Express. I'm not a doctor, but there's, I've been doing this for 5 years now. There's proton beam therapy, there's focal therapy, there's brachytherapy, which is basically they take little beads and they put it in the prostate bed that are radiated. There's more and more stuff coming down the pike. And I must say that in the 5 years that I've done this, advances in radiation are unbelievable. I mean, the collateral damage is getting so less and less and less and less, and the targeting is getting so less and less and less.
Which is so
So
good.
it's or I could have just done nothing. And there's some guys that do that. I
Mhm.
could have just said, okay, well, let's see how it goes.
Well,
But
correct me if I'm wrong too. A lot of the guidance, especially when it comes to prostate cancer, tends to be like, let's monitor with PSA testing and just kind of see what happens, I guess, until there's an elevated level.
But that's called, yeah, active surveillance. So, and
Hmm.
again, it depends on if you have a Gleason 6 score, 3+3. And again, it depends on your age too. I mean, a lot of it is, well, let's just wait and see. Let's see how it goes. But if I was, let's say, if I was 80 years old, I might have gone the radiation. I probably would have gone the radiation route, because the prostatectomy is, I mean, that is heavy duty surgery. I mean,
Hmm.
it is no joke surgery. It's
Hmm.
massive. It's massively invasive. There's great, I mean, the recovery is, but so yes, those were the options that I had. There was a lot going on. So, and also I came across a study that Harvard had done that really said you need to throw everything at this thing, be very aggressive. So I did. I embarked on 36, I call it zappings of IMRT radiation. That's external beam radiation. So you have this big machine and they do a CAT scan. I never said I would get tattoos, but guess what? Because they target it so carefully, they actually put tattoos so they can use that to guide the machine and show the measurements of the machine. And then I went on Lupron therapy. So why Lupron? Well, Lupron is, testosterone is an enemy for prostate cancer. The testosterone, prostate cancer feeds off testosterone. There's all different types of versions, but the goal is to take your testosterone down to zero. And with it comes all kinds of side effects. And so, weight gain, muscle loss, potentially cognitive issues, bone density, hot flashes. So I was on a 6-month course, and I will also say, I in my journey, it's remarkable how men differ. We really are snowflakes. I know guys that had Lupron therapy or ADT therapy that have had no side effects. I know, and I had every one. I'd be in meetings and I'd be just flashing, sweating. People would be looking at me like, what is going on with you? At night, nights were particularly bad. My bed would be soaked. I used to live in Key West.
Hmm.
It was like I was living in Key West again. I mean, it was just so. And I have one more PSA test, and I'll be 5 years in remission. They say NED, no evidence of disease. I'll be in remission 5 years, which is a great. I mean, that it could always come back tomorrow, but that 5-year mark is huge.
Yeah,
So
that's definitely very huge. You mentioned your dad, strong genetic component when it comes to
yes.
prostate cancer. Did you have any genetic testing done? And if so, what was your experience with that?
I'm glad you asked that. So OHSU being the amazing hospital that they are, and I must say all the different, I mean, I was so grateful to be in Portland for healthcare. Oh my God, it just, wonderful. So the genetic team approached me because I'm stage 4 metastatic, and they asked if I want to do a genetic testing. And I said, okay, why not? And I did. And it came back that I had what's called a HOCB13 variant. It's particularly rare. My journey can be, you're the exception, not the rule. That's a title for my journey. And what that does is it makes not only just the male members of my family predisposed to cancer, but the female members of my family. So they were able to extend to all the other members of my family. Of course, I gave them a heads up that they could get tested, and they need to be tested like the male members, prostate cancer screening at 40, the female
Mhm.
members, breast cancer screening at 40. Because they're more predisposed to that. So I was able to give leave a leg, at least give them a heads up, because I didn't get that
Mhm.
from my dad.
Mhm.
So, and there's also somatic tumor testing, but again, that's another rabbit hole. But I did the one, and I have the HOCB13, and thanks to HSU, I was able to give my family members a heads up for it.
Yeah. We talked
Yeah,
so much about the importance of collecting your family history and finding out, especially if any of those first degree relatives have had cancer, that and you could be more predisposed to it, especially with our teen cancer risk reduction curriculum. And that's exactly why it's so important, is so you can start screening a little bit earlier than maybe that recommended age is.
absolutely. Yep, yep. So I'm grateful to
Um,
HSU for that.
yeah,
Yeah,
totally.
yeah.
So, and
I'm
you
glad
mentioned
that
getting involved with a great yoga program too.
I did, because I was stage 4. This OHSU had a study for the physical effects of the 80, hormone treatment therapy. So I got yoga, And yoga has been tremendous, not only in helping me mentally deal with it, but also physically deal with the really horrible side effects of muscle loss, weight gain, balance. It affects your balance, potentially neurological issues. And it just being there with other survivors and being part of this and watching my body, being able to reclaim my body. I was able to reclaim my body from the ravages of ADT therapy, hormone
Yeah,
therapy. Yeah.
absolutely. So, since it's September and Prostate Cancer Awareness Month, I would love to hear more about your advocacy and awareness work. You volunteer with Zero, the End of Prostate Cancer. What has your work looked like in that capacity?
Well, I'm grateful to Zero, and I will probably get there. But one of the things, besides getting told I have cancer, second thought was, oh God, I'm going to go bankrupt. Financial toxicity is a big thing and a big soapbox item for me. So I reached out looking around and I stumbled upon a program they have called 0360. And I talked to a case manager. It's a free program. And I go, oh my God, I got cancer. What can I do? And she goes, well, there's financial aid. I go, really? So she called the Oregon Clinic, which is where my urologist is, and she was able to secure financial aid. Right now I'm at $250,000 plus. Oh my God. So thanks to Zero, it got me down the road of finding financial aid through Providence, through Oregon Clinic, through OHSU. And they offer guidance for insurance. When I first got diagnosed, I was a deer in headlights. I'm like, oh my God, what do I do? And Zero has these wonderful programs. So advocacy. I go down every year to DC, and all these cancer survivors and their caregivers go to the Capitol, and we visit our various legislators. And so I found myself, I've been doing this for 2 years in person. We had virtual one because of COVID. But last year, I went to Susan Bonanici's office, and I'm sitting there petting her Great Pyrenees dog Ripley, asking for millions of dollars of prostate cancer research money, and then meeting with Jeff Merkley's team, and then Ron Wyden's team, and it's preaching to the choir. Thank God. And I know my co-parent, we had the Pacific Northwest team. It was my friend and I, that was it. And so I went with him. I think it's Patty Murray. I think is that, and it's preaching to the choir. But so I do that. I also am involved in that money, the congressionally directed money. It's called the CDMRP program. So the Department of Defense, it started out with women in '97 with breast cancer. When they started bringing women came to the military, they said readiness is a big deal in the military. It's all about readiness, and you need to put money away for breast cancer. So they started this program, and prostate cancer is the number one cancer among veterans. That is the number one cancer. So many reasons, burn pits, Agent Orange, all that stuff. So they spend roughly this year, $110 million. I sit on this group of people. It's called the Congressionally Directed Medical Research Program, CDMRP. I am a consumer advocate. I review these incredible grants, and I'm convinced that prostate cancer is going to come a thing of the past. And I sit there with leading research and doctors, and I present my opinion on particular grant applications as a consumer. What particularly, because these people are brilliant, but they don't sometimes think about the real world experience of what it's like to sit in an MRI tube for
Yep.
8 hours. Oh, we
You
have to
have
do
to have
something.
that patient perspective.
Right. You have to do something about biopsies. It's just so barbaric right now for men. Oh my God. And they will, and it will happen. There's going to be better ways to detect. So I get to do that. Zero does run walks to raise money every year across the country. And I was the race director this year for Portland. We raised $75,000, 10,000 more than last year. And also I'm a mentor. I don't want men to go. One of the reasons why is because I just don't want men to go through what I've been through, whatever I can do. So whenever someone is newly diagnosed and they meet the certain, the stage 4 typically is what I get, and they live in the West Coast, I get a call or I reach out to these men. So I do that. So, and just, another part of this journey is it's amazing how I'll talk to a friend. They go, oh yeah, I had it, or my father had it, or my dad had it, or this guy had it, or that. I mean, it's unbelievable. Men don't talk about it, and that's a whole nother can of worms and rabbit hole I could go to.
Oh yeah.
I just we need to talk about this.
That's amazing. It sounds like you're doing such important work from so many different angles, providing that consumer perspective, talking to legislators about increasing funding, supporting men that are going through similar experiences to what you were going through. It's all super important. Through your work, what are some common misconceptions you hear people have about prostate cancer?
It's an old man's disease. No, it's not. I was just talking to a gentleman. He's 35. He has prostate cancer. There was another gentleman who was 45. Oh, you have the good cancer. Oh, thank goodness I've not been hit with that, but I know other men have, and their families have
PSA,
been.
there is no good cancer.
There is no good cancer. It can be, yes. I mean, there is the slow growth in kind, but there's incredibly aggressive cancer that takes men in like less than a year, sometimes even less than that. So there's, it's not just an old man's. Oh, and another thing is PSA. Just my aggressive cancer, my PSA was never that high. It was never that high. Yeah, it was before. I mean, this gentleman who was the younger guy, 45, his PSA never went above 4. And that's where he had to fight the doctors because they're like, well, you're young and your PSA is low. He has a very aggressive form of prostate cancer.
Do you know what initially prompted him to get a PSA test?
His dad had it.
His dad. Okay. So the
His
increased
dad had
risk.
it. And so it's increased risk. And they never really, he had to beg them to give him a PSA test because I think he's like 38, 37, maybe somewhere around there. And he has an incredibly aggressive form of prostate cancer, and his remained persistent like mine. So when I was talking to him, I shared my experience with him about what it was like to have persistent prostate cancer. So that's another big myth out there. Yeah.
So it seems like PSA tests are the gold standard screening tests for prostate cancer.
Right now they are. They're not the best. They are not the best. We need to get a better testing. And another one is the digital rectal exam, the famous finger. That's another test. There's going to be new stuff coming down. I'm convinced. But right now, those are the two main tests. So again, if you have the family history, if you're African American, that's another thing. 1 in 8 typically Caucasian men, 1 in 6 African American men get it. Hispanics, it's the number 1 prostate cancer among Hispanic audience. It's the number 1 cancer among African American men. So, and then you have all kinds of barriers, access to care,
the financial toxicity, like you said.
Financial toxicity, mistrust of the medical profession for many good reasons why.
Yep.
Transportation. So, yeah.
You've already shared so much good information, but what other messages would you like to share with people who may be going through a similar experience?
Join a support group. You're not alone. Men typically, sadly, will go into a cave and they won't talk about it. They don't want to talk about it because let's face it, it's icky. It's a digital rectal exam, incontinence, erectile dysfunction. This is yucky, but underneath the rock kind of stuff. But please join a support group. That's one of the smartest things, I thank God, because that was really where I initially found out about financial aid. It was even before Zero. Hospitals that are a nonprofit by law have to give out financial aid. They just have to. And I didn't know this. So join a support group, reach out, ask for help, say ouch, take it seriously, please. I'm convinced that there will be a cure. I really do.
That's really exciting. I'm going to be sure to share Zero's website in the episode description and some of the additional resources that you mentioned throughout.
It's a great website, particularly for newly diagnosed men. I'd send men right there to it. It's very well done.
And I'm glad you said to join a support group too. We have a whole variety of different support groups.
Glenn's group. Oh my God.
Yes, Glenn's group. Glenn is amazing. It can really make you feel less alone and provide you with really valuable resources too that you might not have even thought of.
I probably found out more about prostate cancer through support groups than I actually did through doctors. I really did. Men talking to men, cancer patients talking to cancer patients. It's peer-to-peer stuff. Yeah.
Yes, absolutely. Well, thank you so much, Ted. I really appreciate your time. It's been so great talking with you today.
Thank you. I really appreciate your time. Thank you for doing this.
If you or a family member is looking for additional support and resources, consider checking out one of our support groups here at Cancer Pathways. You can visit www.cancerpathways.org/find-support to see the wide variety of support groups we offer, access our resource hub, or set up an emotional support session with one of our oncology social workers. I've also included links in the episode description to Zero, the End of Prostate Cancer, the organization that Ted mentioned, and some information about financial aid, financial toxicity, and understanding a pathology report after a diagnosis. If you found this episode helpful or informative, please share with a family member or friend and leave us a nice rating in your podcast app. I'm Lauren Ryan, and until next time, please stay healthy and well.